Greetings, Douglasville family. As the health and safety of Douglasville citizens remain at the forefront of my concern, I wanted to take this opportunity to review what steps the City of Douglasville has taken thus far to slow the spread of coronavirus COVID-19 and answer some common questions that I have received over the past 2 or 3 weeks. Today is March 30th, and as of today, the stats are this in the state of Georgia, the city and the county of Douglasville, Douglas County. COVID-19 confirmed cases, there's a total of 2,809 in the state of Georgia. Hospitalized, we have 707, and unfortunately, we've had 87 deaths in the state of Georgia. Douglasville, Douglas County has had 1 death. Today, we have 39 confirmed cases. March 11th, these are the time frames. The first COVID-19 messaging went out, urging folks to be cautious and to provide measures put out by the CDC to avoid respiratory illnesses. On March 12th, I sent my first open letter to citizens that was released and encouraged social distancing. March 16th, myself participated with other mayors in the Georgia Municipal Association GMA conference call to determine best practices for cities to respond to COVID-19. The very next day, we had a special called meeting of myself and the City Council to discuss the City of Douglasville's operations. What we decided to do in an ordinance was to close city buildings to the public, suspend recycling pickup services. Now, what that entails is City Hall, we are an essential service, we're government, we do not close. But we've asked city employees to work from home, doing teleconference when available. And we cannot close the police, fire, or sanitation services, so they are still working. But we have staff that they're doing things from home. The city council, myself, have given 80 hours to full-time employees and 40 hours to part-time, and that's paid leave for them to take on top of their sick leave and annual leave to stay at home if they're sick or to provide for child care or for family members if they need it. I then participated in a conference call with Governor Kemp that same day to discuss statewide impact of COVID-19, which was a statewide call with mayors all over the state of Georgia. The very next day, I participated in a call with Madam Chair, Dr. Ramona Jackson-Jones, and key staff to determine the course of action that the city and the county would take collectively to combat COVID-19 so that we would mimic each other and people in the city and the county would be safe. On March 18th, that same day, later that day, I participated in a call with the Vice President of the United States, Vice President Pence, to discuss the nationwide impact, and that call was about 500 mayors from all over the United States. The next day, I released a second open letter which gave COVID-19 updates to the citizens. All this information is put on our social media outlets for the City of Douglasville, our Facebook page, our website. You can go Instagram, all of that, and see what information is out there. On the 23rd, I did an executive order. It increased social distancing efforts to restrict dining in for restaurants to be takeout, drive-through, or delivery only. We closed bars, gyms, and social clubs. We also prohibited gatherings of 10 or more. And all this information was based on what the CDC has said with the President of the United States and the Governor of Georgia. This order went into effect immediately and had a repeal date of April the 10th. On March 24th, the next day, I released another open letter to the citizens of Douglasville outlining everything within the executive order, all the details. On March 25th, I participated in a Douglas County Board of Health meeting, which I am a member. In the Douglas County Board of Health, we issued a shelter in place for everyone in Douglas County. The very next day, myself, I called a special called City Council meeting via conference call that resulted in an adding ordinance to my executive order to shelter in place for Douglas County citizens, Douglasville, Douglas County, that really complemented the Douglas County Board of Health, Public Health, to ask people to shelter in. On the 26th, that same day, later on that evening, we had a virtual town hall with Representative Roger Bruce, Madam Chair, the Chair of the Board of Commissioners for Douglas County, Superintendent Trent North, who is the Superintendent for the Board of Education for Douglas County School Systems, Sarah Ray, the CEO of Douglas County Chamber of Commerce, Dr. Janet Memark, she is Director of Cobb and Douglas Public Health, and the Villa Rica Mayor, Mayor Gil McDougall. Now, some of the common questions that I've been asked, people have, I know everything's out there on social media, but sometimes people just want to talk to me, and I try to answer all those phone calls or email you back or text you back, or, you send stuff to City Hall. If I can't answer all the questions, I send them to staff, but we try to get you an answer. And understand that we are working tirelessly around the clock to get a handle around this COVID-19 and to keep you abreast of what's going on in the city. But some of the common questions are, what does shelter in place actually mean? This phrase, shelter in place, means to stay in your home and not to leave unless necessary, from one of the designated exceptions in the order. In other words, everyone should stay home to slow the spread of the virus. You should limit your movements to essential outings, Essential, and of course that means something different for everyone, but this is some of the parameters around that. Sheltering in place, except for if you have to get food, of course, so you need to go to the grocery store, to pick up prescriptions, go to your doctor, going to work, child care, helping family members get things that they need, essential things that you need to do for your life. What businesses should or should not be closed, this is another question that I've been asked a lot of. The city has not asked any business to close outside of the gyms, the bars, and the private social clubs. So my executive order simply asks people to practice social distancing because that has been what's been recommended to us from the CDC and from public health. So that means restricting dining in to takeout, drive-through delivery, prohibits gatherings of people of 10 or more, and authorizing the shelter-in-place order. So stay in the house unless you have to go out and do those things that are essential for your life. And so businesses, I know a lot of people say, you put money over or tax dollars over people's lives, and that's not what we're doing. One thing that may be a misnomer, I know we think about businesses and we say, well, this restaurant isn't open and that risk and this business, but it's people that are operating those businesses. So it's not just a tax dollar, it's the individuals that have to work at the restaurant. I've talked to restaurant owners. They've lost a lot of money, which we understand. We have to have closed dining in, but they're starting to pay out of their pockets because they have some people that have worked with them for 20 years plus, and they know that those families are suffering. So we're not restricting businesses to close totally down. We're not in a quarantine in that respect. So it's not just about tax dollars, and people say you don't put money over the person, but it's not just a business that is a shell of a business. People make up the business. And so we're trying to be sensitive to that, not just for the economy, but for those families who work at those businesses. 3, is this a curfew in place? I just said there's no curfew, but the executive order does spell out some times. The times are 6 a.m. in the morning till 9 at night, and that's for essential services only. So this is not a curfew, it's just a recommendation from CDC and the public health to lower the curve of COVID-19. We don't want to put a strain on the healthcare system, and we wanted to limit your interactions with people so that you will not contract the virus. So that's why we're saying limit going in and out and just stay in when you can. Number 4, what is essential and non-essential services? There are a lot of exceptions to this, but we'll tell you the essential services in a nutshell can really be summed up in that they're healthcare facilities, grocery stores, foods, banks, convenience stores, other establishments that sell food and household consumer products. I received a text the other day. Someone said there are a lot of people at Lowe's, or Home Depot, and if your toilet overflows or your dishwasher breaks and everyone's home eating, you're going to have to run to Lowe's or someplace because maybe the plumber can't come in your house. So that's considered an essential service. And people, as long as Lowe's has that blue marker, which I've seen on the ground, that it says at Kroger, stand here and the next person in line needs to stand here. And so they are practicing the social distancing and having 10 or less. And really in the grocery store, you can't say 10 or less, but people are spread apart. Everyone, we're using common sense in this respect. But those are some of the other facilities. Media services, newspaper, radio, gas stations, auto supply, auto repair, laundromats, dry cleaners, those types of services. But in my executive order, all the essential services can be found on the city's website. The website is this, www.douglasvillega.gov. The last question I'll go to that is a frequently asked question. The city of Douglasville, are the parks open? This is a tough question here, but I'll tell you yes and no. And what that means is, yes, the parks are closed in the respect of the actual buildings. The structures are closed. So Ike Owens Community Center, Alice Hawthorne Community Center, the playgrounds, the ball fields, the tennis and basketball courts are closed. But the parks are open in that we want you to go to Hunter Park, walk around the lake, because we really want your mental, trying to help the whole person, mind, body, and spirit. So you can go to the park and walk around as long as you are 6 feet apart, and it's 10 or less. But we don't want you to get on the playground equipment. So that is roped off, but the park is open. So you can't use the restroom if you go to the park, but you can go and walk around the park. So the trails at West Pines Golf Course, that is open, but the actual park facilities are closed. So life as we know it has completely changed. We must continue to limit everyday conveniences that we may have previously taken for granted. And as a person of strong faith, I believe worship is essential. Therefore, I encourage our faith-based community to continue to develop creative ways to worship under the guidelines of the CDC. We've gotten a lot of calls about this as well. The governor last week did say that he's heard of drive-in churches, like we used to go to the drive-in movies. When I was real little, my parents would put me in the car. We'd go to the drive-in, bring our own popcorn or buy popcorn, but the car was your sanctuary. And so the premise behind that is that people are in their cars, but they're listening to their pastor. Some have gone to the parking lot, turn a certain station, everyone's listening to the same station, or he has a megaphone. I don't know. My pastor is doing Facebook Live and other means, but be creative in that respect. But churches can meet in that way, but not to have a church service because COVID-19 has spread because of churches and funerals. So we're trying to limit that. Dr. Toomey did say today on my GMA call with the mayors that, and she said this last week on the town hall that was held in the state, that coronavirus, because it's on the Lysol cans or on the wipes that you see coronavirus, and people are saying coronavirus that's already been in effect. What are they talking about? So coronavirus is just another name for a cold virus like influenza, the flu, but COVID-19 is really spelling out that it's a novel coronavirus and it's taken on another strain that we haven't seen before. So coronavirus is like the flu virus. COVID-19 is the one that we have now that we don't have a cure for. They're working on a vaccine, but they don't have the vaccine for that either. So our only tool is to social distance so that we don't spread it, and to wash your hands and wipe off those countertops and all those places where people can touch. So again, I was going back to faith-based. We don't want you to gather in church and gather at funerals. So please practice social distancing. The City of Douglasville, we continue to keep you informed for any local changes from public services. Your health and well-being is extremely important to me and to us. I'll continue to work locally with Douglas County Board of Commissioners, the Douglas County School System, our state and federal governments to combat this pandemic that has affected all of us. And, together we're going to fight this virus and come out on the other side. I'd like to thank all the residents of Douglasville, Douglas County, for their compliance with these restrictions. I know it's tough. We just have to hang in there together. And as your mayor, I promise you I'm tirelessly working for our health, safety, and welfare of the citizens and the surrounding communities. I'd like to thank Mayor McDougal as well and Villarica for working with us and helping us to come so that we can be seamless in Douglasville, Douglas County, and Carroll County. They have a little higher numbers, and also in Cobb. Cobb has, they have more citizens, of course, but their numbers are higher. But if we can all kind of, in the region, circle around each other and do the same things, we hope that we can limit the curve of this spread of this disease. I know you can't put a price tag on health and life, and I pray for the safety of our families. And you know what's been strange to me is that a lot of people, when I answer the questions, they still say or send me back an email or a Facebook message in, or however it's called. Young people know all this stuff about Instagram and all that, but they'll say, "Tell me about yourself," or "Where do you live?" And I just thought that was very strange. And because I would cite all these documents and all these statistics and give them all the information, and they still said to me, "Well, tell me about yourself." And so I was praying about it, and I think what citizens were saying, some of the ones who've asked me that question, they may think that I can't relate, that I'm sitting in an ivory tower making these decisions. And but I assure you that I can relate. And so I'll just say about myself, it has affected me just like it's affected everyone else. I assure you that I understand. My husband and I have to manage the mental anxiety of our children at home. We have 3 children. During this health crisis, everyone's at home now. We're snug in the house. It's changed the dynamics. We're getting out our games to play Scrabble again and watching all kinds of movies. I have 3 children, 17, 19, and 21. Pray my strength. But our high school senior, a 17-year-old, have to try to manage around her not having a prom. We've already bought the dress. You know, we had our makeup all set and everything, and the prom, she can't have her prom because school won't start now. They're saying until April 27th. Prom was April 17th. There's a possibility that she may not walk across the stage to receive her diploma from high school. And all 3 of my children started not just K through 12, they started in preschool. So they were at First United Methodist at 3 and 4 years old. So they've been in school a long time. And to have to say to her, "You may not walk because of this," is something that we just have to talk about and try to make sense to her. And young people, they're resilient, but this is something that will affect them. You know, her brother and sister had that opportunity to walk the stage and wear their gown and receive their diploma, and she may not have the opportunity to do that. My freshman in college, Olivia, and that's Anna, my freshman in college, Olivia, has a 4.0. She worked so hard, graduated from IB at Douglas County High School, and she's been working in college. And then, you know, she received the Presidential Scholars something in the Honor Society and all this. But she won't be able to attend any of those services. Her president, scholar from Kennesaw State University, had a program scheduled. She can't go to that dinner. We had to go and move her stuff out of the dorm in an allocated time. If you're not here between these 3 hours, your stuff is staying here and they're just going to throw it away. So, you know, managing that kind of stress, managing my 3rd year college student, I'm not going to say his classification, but he's doing pretty well. It's a 3.5 and working as well. But trying to tell him with the card that he just received at Christmas that you can't get in your car. Joel, you can't go visit your friends. Just continue to yell at them through your TV, playing your games, and going online, trying to do your college courses. So I understand that weight of having your family at home and trying not to get on each other's nerves. But, you know, that's something that, so I understand what you're saying. I'm not just making these decisions frivolously. I carry the weight of every decision that I make that is affecting someone's life, positively or negatively, and someone not being satisfied. Some people saying it's not enough. Some people saying you're doing too much, you're being my nanny. It's a lot. So I understand the hardship and the loss of jobs and starting over, and how it's going to affect the economy and those families. My husband lost his job about 6 years ago. He's pastored by vocation and worked for corporate America, and he got downsized. And so for 2 years, we were living off our savings because the church didn't pay very much, and he lots of times didn't accept a salary for the 14 years that he pastored. And so losing that corporate job put us in a tailspin of losing a lot until he was able to get another position, and he went to education, which paid a third of what he made in corporate America. And since then, last year, he's gone back to corporate. But for that time, it put our family in a position where we had to make choices about vacations, how we spend money, what we bought. And again, we lost a lot. But what we didn't lose was our family love and connection of coming together. It made us stronger. And so I will say, as we lose stuff in the economy, don't lose your hope, because you can replace things. Even a house you can replace, a car you can replace, but you can't replace your life. And so this is not the time to lose hope and give up and lose heart, but to strengthen your bonds of courage and faith and coming together. And so I would say in closing, Douglasville, know that I'm praying every day. My husband said, I fight in my sleep and wake up in the middle of the night saying, COVID-19. I'm really, it's on my heart heavy, but I do believe that we're going to get on the other side as we stick together as a community and follow the guidelines and continue to pray and fight this invisible disease that we know is very real. But we're going to get stronger as a community. God bless you. God bless the city of Douglasville, Douglas County, the state of Georgia, the United States, and the world. We have to, and I hope I don't offend anyone, we just need to come together and pray and do the best that we can to come on the other side of this. So thank you for your time, and God bless you.